The whole issue of self-esteem and self-blame, I find, is so deeply embedded that it just takes a lot to be able to get there. You mentioned self-compassion, and a lot of the patients that I work with, they can't get there. You say compassion and they're sneeringly contemptuous of how could I be compassionate towards me? And they'll say things like, if my parent, my mother, my father said this about me, and they said it over and over again, or they joined each other, then that must be what I am, or that must be what's supposed to happen. So I find it to be deeply, deeply embedded, and I think exactly what you're saying about really surfacing the emotion and the hurt that goes with that, and the pain, and the anger, and the shame. All of those are very primary emotions that need to be tapped, and the person needs to get into. Of course, most of these patients are very avoidant, and they would like to stay away from that because it's very painful to them, and it may be what keeps them stuck in a rut of not ever being able to resolve anything, not ever being able to differentiate, and being chronically suicidal. And I think that's where the concept of psych-ache and psychic pain and how much it hurts to have a parent or someone really significant say something like that, that it gets in much, much more than it would be for a non-attachment figure, a non-significant person. And I think that when you look at parenting and help parents to be parents and to understand these things, they need to know and appreciate the impact that they can have on a child and the impact that words have.
Yeah.
Sometimes even more than behavior. I had a patient just this week who has been extremely suicidal and self-injurious, who, as we've been talking about her history, she's had a really hard time. Her mother was very verbally and physically abusive from a quite young age, and she's had a really hard time explaining that in any way except that it was about her. And she's like almost impervious to it could be something wrong with her mother. And this week she broke down and she started to cry, and she said, how could a mother look at her child and see the pain on her child's face and continue to do that? And it must have been about me. And it was so interesting because I was sitting there wishing she would say, oh, there was something wrong with my mother, but she still can't go there. It's all about her. And for me, and episodes or stories like that always bring back the voice therapy and what I learned about this internalized voice that's so negative and so harsh. I have used voice therapy in that whenever I have cases like this where a parent's voice is coming through loud and clear, or somebody else significant for that matter, is coming through loud and clear for someone who's feeling very despondent about themselves or suicidal, I always think about the voice and where did that voice come from.